and welcome to the Columbus Metropolitan Club. I'm Deborah Price, a member of the CMC's Board of Trustees. My day job is at the great law firm of Ice Miller, and I want to welcome all of you here today. So today, CMC's forum, Healthcare and Executive Perspective, is sponsored by Cardinal Health and PNC, each who have many representatives and friends here, and so won't you please help me thank them for sponsoring today. Well, folks, today's healthcare landscape is a tale of two worlds. In one, technological advances provide amazing new treatments, diagnostic tools, and miracle medicines to combat injury and disease in ways we couldn't have dreamed of just a few years ago. In the other world, for many folks, the cost, the red tape, paperwork, the lack of easy access to medical care makes navigating and staying afloat in the system a nightmare. Extraordinary medical bills continue to be the #1 cause of bankruptcy in the United States. In 2015, a Kaiser Family Foundation survey found that 26% of Americans aged 18 to 64 struggle to pay medical bills. That's about 52 million adults. Our healthcare systems, the intermediaries between the insurance companies, the medical professionals, pharmaceutical companies, patients, and governments, strive so hard to do the right thing for everyone, but they're caught in the middle. We look forward to learning more from two of our nation's top executives in the field today. Please help me to welcome President and CEO of Ohio Health, Dave Blum, President and CEO of Nationwide Children's Hospital, Steve Allen, and moderator today is President and CEO of United Way of Central Ohio, Lisa Cordes. Lisa, the podium is yours.
So it's a privilege for CMC to have two of our community's leaders join us today for a conversation about the changing landscape of healthcare, innovation in the industry, and the impact of their work to improve the lives of people in Central Ohio. A study commissioned by the Central Ohio Hospital Association, Jeff Klingler's in the house, there you go, found that our hospital systems, the four that we have, contributed $10.2 billion in 2015 in economic benefit to Franklin County. And that's just one county. The systems that are represented today represent many, many counties. Ohio Health is our second largest employer in Franklin County. Both leaders have announced their plans to retire from their current positions effective in 2019. But I was reminded that they have many more months on the job and work to accomplish, so we are not bidding them farewell today, but we are celebrating their accomplishments. Under your leadership, the growth and the impact of your respective organizations has been remarkable. In summary, at Nationwide Children's Hospital, Dr. Allen started in 2006. The gross revenue at the time, the gross patient revenue at the time was $1.5 billion. It is now $2.6 billion. And the number of staff in 2006 was 7,000. The number of staff today is 12,000. Dave Blum was named CEO of Ohio Health in 2002, serving now nearly 16 years in the role. But he has been with Ohio Health since he was born. He's been with Ohio Health for 35 years. I know how old you were when you started, but I won't say it. When he started as CEO in 2002, the net operating revenue was $1.3 billion. Today, it is $4.3 billion. And the number of associates in 2002 was 15,000. Today, it is over 25,000. So let's start by having you share this tremendous growth that's happened in the last decade or more under your tenure. What was it in the landscape that allowed you to have this growth, and how did you capitalize on that?
So I think at Nationwide Children's Hospital, we have a mission that goes back 126 years that we are going to make sure that every child has access to high-quality care, regardless of their parents' ability to pay. And what we've done over the years is just progressively expanded that initial mission to try to make sure that we meet the needs of all the children. We now have a catchment area that covers not just Franklin County, but a 34-county region that incorporates central and southeast Ohio, so there's growth that has come there. We also have relationships with community hospitals, many of whom we were introduced to by Ohio Health, that goes up to Lima in the northwest part of the country and all the way down to the Ohio River Valley to the southeast. In addition to that, besides providing for the care of all these children, for which we still enjoy a positive growth of population in Central Ohio, which not all our colleagues can brag about, we also have programs that attract children from all 50 states every year and from dozens of foreign countries. And so we're very proud of the fact that Columbus, Ohio is just one of the best places to come to if you need world-class care. Just the community, the airport, just such an inviting, welcoming, caring community for us to be able to grow outside the area of referrals.
So before I jump into that, let me just say that it's been a lot of fun working with Steve and the folks at Children's over the last few years. It's been a very collaborative relationship. I believe that we've done good things for all of the communities that we serve. And the working relationship is just so easy. It just doesn't take a lot to get things done. So I just wanted to say that. Why have we grown? How have we grown? First of all, Columbus is really a pretty good place to be. You know, population growing, what, 2%, 2.5% a year? Guy, is that right? About 2.5% a year? So, as opposed to Cleveland or a few other places where they don't have that. Second thing is, we're a community-based healthcare system. We teach, but that's not our mission. We do research, but that's not our mission. We live or die by how well we serve the communities where we are. And we've worked hard to be geographically proximate and easy to use in Central Ohio, and then take that same model to Mansfield and to Kenton and to Mount Gilead and to Athens and Marion and other communities that we serve, and work just as hard to serve those communities as we work here. And the model we have is we believe healthcare ought to be delivered as close to where people live as possible. I know when my mom lived in Waverly, Ohio, I couldn't blast her out of there to save my life. You know, shoot, I run Ohio Health. You'd think I'd have a little, I didn't. So, but people want to get health care close to where they live. So the extent that you can do that effectively, and with good conscience, know that you're just delivering as good a quality care in Kenton, Ohio as you are in Columbus, the communities really appreciate that. And then have an eye to the cost of that health care as well. And if you can't do it as well, then don't do it. And be clear with the communities about that. And if they get care elsewhere, get them back there as fast as you possibly can. But that has allowed us to do, though, in those communities where we do that, they understand it. We talk about that. And then you're rewarded if patients need more complicated care. They tend to use your facilities for tertiary care back here. And that's a model that we've used for the last 15, 16 years, and it works. It works. And so when other communities, healthcare systems, their hospitals start to struggle, and believe me, they're really starting to struggle. As economics get tougher in healthcare, they're really starting to struggle. We're positioned with a model, staff, structure, infrastructure, attitude that makes that work, and we're quite often the first folks that people think of. That's what has engendered the growth. So if you think about our $4.3 billion of revenues, 1.7 is outside of the central Ohio community. It's in those other communities. So over the last few years, we've become much more of a regional organization rather than just centric here.
I'm going to ask him a question.
All right.
So what's your, obviously, we've been able to benefit from riding your coattails as you pursued your regional strategy. Where do you see that going? You have a lot of other colleagues around the country who've pursued a wide variety of different geographic strategies, but what is it that you think is right for Ohio Health?
So we've given that a lot of thought. You see a lot of consolidation in healthcare around the country, and you got Chicago merging with Milwaukee, and you got the Catholic systems merging all over the place. And we've pretty well defined about a 47-county region. So stick with me on this. Let's go north to Huron County, and go west to Springfield, and south to Portsmouth, and east to Cambridge, Barnesville, the river, south. That's 4.2 million people. That ought to keep us busy for a little while. And our goal is, so that's kind of a natural, I'll use the word trading area around Columbus, arts, shopping, healthcare. And to the extent we can take that, deliver care close to where people live within that 47-county region, it makes a lot of sense. Once you get outside of that, then that keep healthcare local, tertiary care comes to Columbus, that model just doesn't work. And it's been a really useful discipline, actually, over the last 10 years to have that in our brains, so that when someone from Akron comes knocking that they're having trouble, we just say, sorry, that just doesn't make rational sense for us. So you take that region, 4.2 million people, that's probably the next 5 to 7 years, right, Steve?
So we have 1 in 3 of us in Franklin County are living at 200% of poverty or below. And we're a thriving community. So I wonder, when you start to go out to those 40-some communities, how can you afford to deliver the care? What's the layman answer to that?
So I guess I have a couple things to say about that. We take care of anybody that comes through our doors. I'll even go a step further. As we think about how we allocate capital, we're conscious to keep that a balanced distribution of capital, not just in Dublin, but at Grant, and not just, so we do that. The second thing is, about 14 years ago, we got the CFOs of all the hospitals in the county together. Tim would remember this, that we all agreed that we would have a generous charity care policy here in Columbus, Ohio, with the hospitals. We didn't adopt the same policy, but a very similar policy, because we didn't want one organization to be advantaged over the other one, so that the charity care distribution would mirror, to the extent we could engineer it, the market share of the institutions that serve the people. Now, geographic differences make a difference. I got all that. But the charity care policy in the institutions in Columbus is more generous than most other communities around the country. And so that's one. We don't have a charity care hospital. You go to Indianapolis, Pittsburgh, Buffalo, Cleveland, Chicago, Atlanta, Dallas, they all have charity care hospitals, and that's where the poor people go. I'm not saying they get bad care, but it's not everybody carrying their fair share, and we do that here. Now, you ask about the region, you just take care of everybody. You just take care of everybody, and if you're going to go to Cambridge, Ohio, you better be ready to take care of the Medicaid population, because there's a lot of them there. And that's just a decision that we made. Steve, you want to add on to that?
Well, I compliment that. It's a little bit different for children in that, and I want to recognize our legislators who are in the audience today who've just been superb. But besides being able to, for families who qualify for Medicaid, but the children under the age of 18 can qualify if their families are up to 200% of the federal poverty line. So we actually have very few children in this country, and particularly in this part of the state, children who are uninsured. Now, Medicaid does not cover our cost of care, but we have a balance between commercial and Medicaid, and then we have a very innovative program, again, calling on Tim Robinson, who had set this up some years ago, where we go at risk, and we've been able to show that we can save the state some money and bend the cost curve on that. So I think you will hear most of us say there's enough money in the system. It's how it is that people choose to allocate it is what the continuing challenge and opportunities are in American medicine.
So let me add on to that. I would agree with that. But, regardless of your politics, Medicaid expansion has been a huge benefit for the state of Ohio. For Ohio Health, we went from 8% charity care, which means no money, to about 3%. Now, the margin on the Medicaid patients isn't very much, but it's something. It's something. It's made a huge difference. And there are people getting care today that would not, were it not for having the expanded Medicaid program. And in this era of infant mortality and opiate addiction, a lot of that money goes to those areas.
Your relationship speaks to the Columbus Way. Can you describe some of your partnerships and how they came about?
So I would say that particularly my institution I think we have a great institution, we have fabulous people, but it wouldn't have become what it is in any other city other than Columbus. There is and I'm not from here, so I feel like I can say that with some authority. There is a commitment within this community of caring for others, of collaboration, of entrepreneurship, of being innovative, and a long tradition of high-quality health care that really, I think, informs not just the people in my institution, but the people who interact with us and the others that we interact with in the community. So when we talk about how it is that we interact with the community here and the collaborations we have with our adult partners, it's just not like any other place in the country. They all have a different set of challenges they have to go jump over that we are just so fortunate we don't have to do. And it makes it a great place to recruit people to from elsewhere.
I am from Columbus, and I'll still speak with some authority on this topic. And because I can speak to the way it was and the way it is. And the way it is a lot different than the way it was. And the was to is changed in about 2007, 2008, and 2009 when we were feeling I don't know the first time, but the first time in a couple generations, an impact of a recession here in Columbus. We saw job growth stagnate. We saw incomes dropping, and we weren't growing. In Columbus, it always kind of chugged along. It was growing 1% a year, and all of a sudden we weren't. And so the community leaders gathered around that moment. And so what do we need to do collectively to put our parochial interests aside and re-engineer how we do economic development for the city, re-engineer how we interact as leaders in the community and do it differently. And that's when Columbus 2020 was born, and a whole variety of things changed. And that was a huge inflection point that I was able to witness and actually be part of. And I'm proud of all that work, actually. And that has created an environment where we can innovate, collaborate, join hands like we did this morning at 7:30 to talk about what can we do to make the United Way even better next year. That would be that'd be a long putt in many, many communities, and here it's just kind of how you do things.
Which of your partnerships are you most proud of?
I think the one that adult institutions do with us around quality and safety. I mean, people show what their data are. They collaborate in a way where it's for the good of the greater community. I think the thing that I really like that the adults have done, which doesn't impact us, is that one of the challenges across the country is a number of people who have mental health issues showing up in emergency departments. And they're showing up in emergency departments because there's still a lack of adequate access to it. But some communities just really struggle with it. Ours, they all got together and said, we're going to establish a bed board, and every morning we're going to see who's EDs and where there are open beds, and we're going to send the patient to whoever it is, and we're not going to play games with it. And to me, it's just been a remarkable success. And so many other places, people would end up trying to game the system in order to benefit themselves with a short haul. But that just, I sit in and listen on the conversation, and I'm just always taken aback about how proud I am to be a part of a group of people who know they're always going to put the needs of the community ahead of themselves.
Partnerships I'm proud of, I'd say the Central Ohio Hospital Council's one. We got together a number of years ago after a particularly contentious time between the hospital systems and said we can do better than this. So at least once a quarter, we all have to sit across the table from each other and at least look each other in the eye, and can't do anything too stupid. But we have made progress, like with the bed board, like with opiate addiction, like with infant mortality, like trauma planning, like the bed supply. I mean, I can go on and on of things that we have dealt with. And I'll add to that, the other partnership we're proud of is just being part of the community. We realize that we're the second largest employer, so we have a role in the community to assuring that it works. And we work hard to make sure that it works.
Today, what are the greatest health threats to our community? And then we'll ask Dr. Roberts if she agrees.
I mean, that ranges a lot of different areas. We have a particular focus on behavioral health issues, and that's primarily because there's just a lack of sufficient access to it. We have a big investment going on to try to reduce that. But there's things in our society that is creating more problems for our children than we think existed before. I think the rapid rise of how quickly technology is impacting our children and adolescents who've never, there's plenty of children who've never been without a phone in their hand. And we really have yet to understand what the long-term impact is on their development. And then for us, as a children's healthcare organization, the issues that affect children's ability to reach their full potential, it's about 30% of it is healthcare related, and 70% is stuff just out in the community, things that we tend to call social determinants. It's poverty, it's homelessness, it's unstable education opportunities, things like that. Those are the things that I think concern us about how it is that we best address those for the next generation.
A lot of things come to mind. Two of them I mentioned. One was the opiate problem. We haven't seen the peak of that yet, I don't think, have we? I don't think. And there's a lot of collaboration around that, but it's a lot of that is process, and we don't yet know the real levers to pull. We're pulling some of them. Mental health is a huge issue, although we're making a lot of progress on that. As a country and as a healthcare system from an economic standpoint, all the incentives are for acute care and very little for the management of chronic care. And we're starting to make progress on that with organizing our primary care practices with medical homes and infusing advanced practice people and in those practices so the chronic care issues can be managed more comprehensively than they are today. But we need to put more resources into that, but it's difficult to do because insurance rewards procedures. And so that whole transition, I believe, over the next, I'm not even going to guess, number of years will happen. But I believe it's going to happen with the healthcare systems driving it, not the government driving it. Because there's too much lobbying money going the other way. I can ask Joyce or Pat about that. But there's a lot of money from the device manufacturers and drugs, et cetera, that reward more healthcare rather than smarter healthcare. And here in Columbus, we're fortunate. I mean, organizations like ours are working with some employers directly to go at risk from an employee's health care. And we're going to be incented with them along with the doctor. So to reform health care, everyone that touches the system has to have a stake in that game. If you're a doctor, that gets paid to do more. If you're a hospital administrator, it gets paid to do more. If you're an insurance company who likes complexity in the system, and you got a patient who has no economic risk, where's the incentive to make it more efficient? And I believe those are starting to converge, at least in the private sector, at the employer level. And I think the employers in Columbus are ready for it. We're fortunate in Columbus to have a lot of big employers, sophisticated thinkers in this space, and they're starting to work with organizations like ours and others to really be conscious of how those healthcare dollars get spent, and organizations like us will go at risk to help make that happen.
Both of your organizations have been recognized nationally as best places to work. So we all could learn a lot from you. What are your lessons learned, and how did you accomplish that?
Change in an organization is difficult, and for it to stick in it, to be effective, it has to start bottom up, led from on top. And I believe one thing that I've learned is that the more you have your associates engaged, both with the best talent, and they know what it is you're trying to do, and they're recognized and rewarded, so you have their hearts, then you can really get some things done. It makes you much more nimble as an organization. When you have the organization right there with you, trying to help make it happen, rather than just doing it top down. So I believe that's been part of our secret sauce, actually, is to have a culture that embraces change, understand why it's important, not just to the institution, but to the community. Because I think folks believe if they're going to go to work, there is a higher purpose than just getting a paycheck. And we've tried to accomplish those things in our organization.
I couldn't agree more. I think Dave articulates all that really well. We have a group of values, our one team values, that every one in the organization, including me, is judged on each one of those on an annual basis. And then we encourage employees to feed back to leadership when they see us behaving in a way that's not consistent with those values. And then I think as Dave was saying, the housekeepers, dietary nurses, surgeons, scientists, everybody watches to see what we do and how we make decisions. And as long as we continue to show that our decisions are judged by what's in the best interest of the child and the family, then we have their support, and we can get them to do incredible things. But it's being true to the founding mission of the place and continuing to hold that as how it is that we're going to run the place, regardless of the financial implications, I think is what gives people the meaning that they derive from working at Children's.
What are the greatest opportunities for your successors?
Don't mess up.
And you can speak right to Dr. Markovich.
So the Ohio Health Board in June appointed Steve Markovich. Steve, raise your hand. Steve as my successor. We both, in fact, the whole organization is working really hard at this transition, and I feel blessed that we've got a year to do it. And so over the course of the year, I'll start backing up, and he'll start stepping forward. and have the year for he and I to go through together the processes on an annual basis that the CEO has to lead, from governance to banking to et cetera, et cetera. And our goal is to have this be as smooth as possible, that there's never a moment of paralysis, that there's a flow and a smoothness and a recognition of the organization, of a smooth transition of the CEO role.
I'm not going to let you off the hook, but I will say we're going to move the audience towards questions in just a few minutes. So please step up to the microphone, and please don't be shy, and it is right straight ahead. Your successor.
Children's is really in a great place right now. It's got a strong financial basis, it's got an incredible community support, it's got fabulous buildings, it's got all the things needed. The challenge for my successor is to take it to the next level. It's an elite destination children's hospital, but I believe the vision of this community for the place is that it becomes the leader in how it is that we think about healthcare for children in the future in a more expansive fashion. And there's no reason why the place can't achieve that. It's got all the really good things going for it, and why not go for it?
And what have you learned from each other?
Well, I'll jump in there. I got here in 2006, and I met Dave briefly, and I knew who he was. I didn't know anything about it. And again, being from the outside, I didn't even know one here in Columbus. And you're trying to figure out where people are and, how you're going to interact with them. And I was talking to him about something, and he mentioned that he had just given some remarks at the opening of his hospice, which I thought, well, that's kind of interesting. A lot of adult healthcare systems have really shied away from doing that kind of thing. And I said, well, I'd be interested to see what you said. He said, well, I'll send you my remarks. So he sent me my remarks. And my wife, who is also a physician, we read through and says, my goodness, this guy's an inspiration for anybody who wants to go into healthcare. He gets what this is all about in a way that can teach the rest of us. So I think from that moment, I said, no, this is a guy who I can learn from. And Dave has continued to be that kind of mentor, but I think also that leader in the community about what's best for the rest of us.
Thanks. Thank you. Steve and I have had a wonderful partnership, and we don't do children. We deliver babies. We take care of them for a little while, but then after that it's Children's Hospital. And we had some pediatric units, and we trained some pediatricians, and through all that said, that makes no sense. That makes no sense. Let's turn it over to those that have the scale and skill set to do that, and the attitude and philosophy that we agree with. And Steve and Children's Hospitals have been wonderful, wonderful partners. As I said earlier, it's just so easy to work together on some things that are very, very important. Over the years, my wife Chris and I and Steve and Jamie have gotten to be friends. We get together every so often, so the relationship is a close one that I believe will continue even after we're not doing this.
Would you like to share some of those secrets of when you're together?
No.
It's CMC's tradition to take audience questions. Please state your name and ask your question. And in fairness to all, we'd like to get as many questions as possible, so please avoid editorial comments. And questions end with a question mark. First question, please.
Thank you. I'm Bill Wayhoff with Steptoe & Johnson, PLLC, and I wanted to thank, as a member, I just want to thank you for taking your time to have this program, this wonderful program. It seems as though there's a lot of growth west of the Scioto River, and I wondered if there was the feeling that that area is going to be adequately served with that apparent population growth, or if there are plans to increase the resources over in that area. Thank you.
So geographic coverage is a key strategy for us. Our goal is to have health care within 7 to 10 minutes of every resident in central Ohio. We're almost there. Some areas west of the Scioto, we're probably not quite, but we will be. People don't like going to Riverside or Grant because it's too hard to get there if they don't have to go there for something that's very acute. And people want health care that's simple, affordable, easy to use. And so to meet that need of the changing consumer, by the way, those consumers now who spend a lot of their own personal money for the first $1,500 of their health care spend a year, you had better be able to have the resources where those folks want them. And so as consumerism becomes more prolific in healthcare, and I believe it even will be more so, we have to meet that demand, and that isn't in a giant hospital for something that's fairly simple.
Hi, I'm Bill Lafayette. I own Regionomics. And I recently saw a family member who was ill but not very consult over a video link with a doctor based in Rhode Island. And I'd just be interested to get your take on that whole movement and whether it represents an opportunity or more of a threat for the medical community here in Columbus.
So I think that's a great question. I mean, we've been talking about that. It's been part of what I've been involved with for 25 years, I guess now. Conceptually, it sounds like a great thing, and we have looked at seeing how we can provide more access to our specialists who are based here to the more rural parts of, particularly the Southeast. But for a lot of patients and families, they want to have physical presence. This is even true for some of the behavioral health stuff, which we thought would be a no-brainer. And so those that we have tried, we still have a couple going, but most of them, it works out better that we just need to send people down there or bring them up here. So I don't think it's the technology, because the transfer rates is such that, I mean, it's a really good image and the sound quality is good and you can get all the other stuff, but there's something about the physical presence that people seem to miss, and we just haven't gotten over that yet. But, you know, we keep thinking this has got to play out at some point to make it more efficient.
I do think that's a technology that will continue to become more popular, particularly in neuroscience, particularly in management of acute patients in an ICU. We have an EICU where we manage ICU patients in 23 different hospitals around the state with an intensivist who's in the telemedicine center 24/7. We're starting to see it more in behavioral health. But here's where I think it's really going to come into its own, and that's in these more rural communities that can't afford to have the specialists in their communities. There's not enough people that will support them, and they want healthcare close to where they live, and doing it through telemedicine, I think, will be something that we will see more of.
Hello, my name is Clark Schuler. I'm a Fisher MBA student, and I'm interested in healthcare innovation as a field. So I wonder if you have any thoughts on how you've managed to stay innovative and grow in the face of the obstacles you've mentioned, like entrenched interests from pharmaceutical companies, government regulation, et cetera. How do you keep that competitive edge and innovate? Thank you.
I will start. So you do it in lots of ways. One is you resource the people that you have in the organization that have good ideas and support their ability to develop them and perhaps even take them to market. So supporting folks here is one. Second is we have put a fair amount of money in some fund-to-funds that invest in healthcare technology companies. And by having those investments in that fund, we sit on the board of that organization that listens every quarter to 4 or 5 new technologies that someone wants to bring to market. We won't invest in all those. We may not even believe half of them. But if there's 1 or 2 that have real potential, and we bring those we bring those home. So it's surveying the market through the investment capital market and then bringing those opportunities home.
I think that there's almost no aspect of operations of a healthcare center that look exactly today the way it looked 10 years ago. It's just part and parcel of running an organization where you're constantly under expense growth pressure to figure out how you can do things in a cheaper fashion. We engage, as I suspect many others do, every year in an 8-figure engagement about how we can cut expenses. And that's the only way to do it. We're not going to deliver less care. We just have to figure out how to do it more efficiently, in addition to the stuff that Dave mentioned. And I think it's just part and parcel of how it is that you have to run healthcare systems these days. That's just always top of mind. How can we figure out how to do this better, less labor, more expensive, more efficiently? Great question.
Hi, Margie Pizzuti with Goodwill Columbus. I had the honor and privilege of working at Children's for 10 years and also worked really closely with Dave Blum, so you're a gift, both of you, to this community, so thank you. My couple of quick questions. One is, and you alluded to it, 12, 13 years ago, we had the threat of Columbia HCA, a for-profit hospital system, coming into the community. Perhaps embedded in some of your comments is what we did and why that didn't happen back then. And that would be my first question. The second one is around nonprofit health and human service organizations and how we're struggling to provide health care benefits to our employees, and any ideas about what we can do to make sure that we're competitive in covering our employees with benefits.
Steve wasn't around when Columbia came to town. I was. Columbia HCA came to town. Margie is probably 18, 19 years ago.
Oh my gosh, okay.
And the community leaders didn't want it, but they couldn't stop it. And they almost came, were it not for a big fraud case that led, actually it was Doctors Hospital at the time, who had a letter of intent that canceled based on that piece of news. So we were close. What can employers do? I would say most employers feel like they're victims of their health spend, as opposed to have the ability to manage it more effectively than what they do. And there are things that can be done with your health spend if you talk to people that are really expert at it, to adjust the trajectory of your health spend, all the way from plan design to your network, to managing the care process, to there's a whole variety of things. In fact, we have an employer services division that has contracts with 4,000 employers in central Ohio and in the region. We've got 500 and some people in that division that just work with employers all the time to manage their health spend. One thing that I've noticed employers do is that they turn over that health spend to their benefits department, as opposed to elevating it into the organization to a level where the benefits department might get a louder voice, or to folks who might have greater creativity. So if you think about, as a business, how much money you spend on health, do you have your best people running your health spend? And most employers will say, no, that isn't the case. So I just think we don't have to be victims to our health spend, you have to manage it.
Hi, my name is Mary Corn, and I have two separate questions for each of you. And by the way, thank you for being here. It's just been enlightening to hear you speak. So, Dave, for you, I've been connecting the dots of what I'm hearing, which is risk, rural, chronic care management, and telehealth. I'm hearing that the wave of where the world is going is chronic care. And correct me if I'm wrong, chronic care management, telehealth, interfaces with the concept of risk, because telehealth may enable far greater management of chronic care conditions that, coupled with great care management, could reduce cost. But your thoughts on what I'm saying?
That was really pretty good. I would add wellness and prevention to that litany.
Excellent. Excellent. Thank you.
That flows over into the chronic care. Why don't you add on to that?
No, I think that's right. I think we look at chronic care, acute illnesses. For children, it's injury, trauma, things like that. Yeah, I think that's all kind of part of it. The vast majority of children only have episodic disease. It's a relatively small percentage of children who have significant chronic disease, so it's just kind of reversed from what it is with adults. So we need to be focused on all the things and make sure they can stay in school and be able to grow up academically and socially to be able to carry on their lives.
I'll probably add one thing to your list,
Okay.
and that's end-of-life care.
Oh, excellent.
And until we come to grips with that a little more openly than we are, we're never really going to get it.
That's good. And I have a question for you, which is, I heard you mention concerns about children and technology, but as I was listening to you, I couldn't help but think that related to telehealth and self-monitoring, maybe this is a positive way to connect children using telehealth as a vehicle, that instead of just playing games, telehealth might be used as a vehicle for them to be concerned and manage their own care. And your thoughts?
Yeah, I think if I understood, you're saying that we might be able to use their technology to be able to interact with them and help them participate in their own self-care?
Yeah, potentially. And what are your thoughts on that?
Right. No, I think that's very true. Kelly Kelleher, who's in the back, did a great project where he found that doing depression screening in adolescents, that they were more likely to give an honest answer to a device than they were to a therapist who's been trained to interview them on it. So no, I think there's a great thing. And as you may know, there's these algorithms out there that track social media that pick up certain phrases and terms that have a high predictability of who's going to have some significant mood problems. So no, I think we've just begun to scratch the surface of what we may be able to do with that.
Fascinating. Thank you.
Thank you.
We have time for 2 more questions. Your question has to be quick, and your answer has to be quick.
Hello, my name is Carla Sokol. Thank you both for being here this afternoon. You've talked about prevention just a little bit, and I think we all agree of its importance. We know that scientific research has proven time and time again since the 40s that a low-fat, whole food, plant-based diet can prevent or reverse diseases such as diabetes type 2, cardiovascular disease, Crohn's. It's really a laundry list. At what point will Ohio Health and Nationwide Children's Hospital start implementing a low-fat, plant-based diet and teach people about proper nutrition and prevention?
I think we're doing it now. Our primary care doctors do it now. We have a clinic over at McConnell that does that. We do that now. But it's interesting. Most of us really don't take it seriously. I know I have to be quick, but we have an employer where we're at risk for their diabetic patients. And these diabetic patients get free meds if they stay on the program. That still wasn't enough. We had to give them cash for them to really pay attention to stay on their diabetic program. So if that's the case for a diabetic patient who really knows they're at risk, a healthy person to adjust their lifestyle, as you were suggesting, worthy goal, we're doing it, but it's hard to make it stick.
I'll just use one example to be quick, and that is that during my time there, first thing we did is we said we're going to eliminate any smoking anywhere on the campus. Can't do that. got a little bit of a rise, some pushback. You know, a lot of our patients come from places where there's a high incidence of smoking, so the parents weren't too happy with that. But when we said we were getting rid of sugar-sweetened beverages, yeah, then that really created it. So, I mean, I think it just tags on to Dave's point, is that it's difficult to change people's eating behaviors.
Roger Blackwell, business consultant. I heard 3 men walked into a bar one night, one named Jeff, one named Jamie, and one named Warren, and walked out with a healthcare company. So my question is, how do you think Amazon et al. Getting into healthcare will impact hospitals and healthcare?
We don't know yet. There's a company called HTP, Health Transformation, HTA, Health Transformation Alliance, that did this a year and a half ago and has just as many employees as the one that you are talking about. They hired a staff. They've got a lot of influential people involved. And the first thing they did was sign a contract with a big pharmacy benefit management company that has had huge impact on those employers' cost. The next thing they're working on is bundled payments in certain markets for disease states that are high risk in those markets. That is an experimental program at this point. So if history is a predictor of the future, I think that is a pretty good one, and I believe that's probably where they'll start. But we'll see. Healthcare is really local, and a market is a market, and having a strategy for the whole country, I think, is quite difficult. But I guess we'll wait and see.
I agree.
Thank you.
Okay, well, we want to thank you, speakers. What a wonderful conversation today. It certainly takes more than brains and know-how. Your gift to our community is both of those, but also the heart you've put into it over these years. And aren't we lucky to have had them and to still have them for a little while longer. So thank you very much. Thanks again to our sponsors, Cardinal Health, PNC, and to our speakers, Dave Blum, Steve Allen, and Lisa Cordes. Thank you all for being here. Join us every Wednesday.
I figured you had.